Hello and welcome to the MKM Healthcare, the role of the chaperone training. Before watching this presentation, you should answer the 4 questions from the booklet. Dr. Aylin was a GP in Kent who practiced for many years. In December 2000, he was found guilty of 13 counts of indecent assault on 10 women during intimate examinations during the period of 1991 to 1998 and was jailed for 4 years. In 2004, the committee looking at the use and the role of chaperones recommended the following. They recommended that each trust should have its own chaperone policy and this should be made available to patients. You can do this by advertising it on your website, in leaflets, and also ensuring that you have posters in all clinical rooms. They also recommended an identified managerial lead with appropriate training. It was also recommended that family members or friends should not be used as a chaperone. It was recommended that the presence of the chaperone should be the patient's choice and that the patient can refuse to have a chaperone available. They also recommended that all chaperones should be trained. So which examinations should a chaperone be offered? A chaperone should be offered in all examinations, or in intimate examinations involving the genital areas, breast examinations, anal examinations, and a chaperone should be offered regardless of gender of the patient and of the healthcare worker. The role of the chaperone is to act as an advocate for the patient. They will also be a witness for events, so therefore if any accusation or allegation is made against an individual, the chaperone would be able to relay the events that have taken place. They will also be able to provide reassurance for the patient, and they will also be able to provide assistance for the patient. Maybe the patients need assistance with undressing or dressing, and they can also assist the healthcare worker. So they may need to pass them certain instruments, etc. In some cases, they may also act as an interpreter. It is important that privacy and dignity is maintained at all times. Make sure that the patient is given privacy to undress. They should be left alone behind the curtain to undress if they are able to. And the use and the presence of a chaperone should always be recorded. If a chaperone has been offered for an intimate examination and the patient has declined this, then this should also be recorded. And the chaperone really only needs to be present for the actual intimate examination, but the chaperone should have an understanding of the reason for the examination taking place. Factors that need to be considered when using a chaperone. Is a chaperone required? And also, is there a chaperone available? In the situation where a chaperone is not available, then you would have 2 choices. The patient would either have to rebook their appointment, making sure that it is noted that they have requested a chaperone or that a chaperone is required, or in some circumstances it may be possible for them to wait until the end of the clinic and then they would have a chaperone available then. Also, it's very important that the chaperone is trained and knows what to do. It can be very embarrassing for both the patient and the chaperone if they are not aware of what they should be doing. Quite often they are not even sure where they should stand. Should they stand behind the curtain or inside of the curtain? Well, when acting as a chaperone, it's important that you can see and hear everything that is taking place, so that in any allegations or any situations where you were required to give evidence, you would be able to relay this information. Therefore, you really need to stand inside of the curtain. In most circumstances, standing beside the waist would be the most appropriate place. By standing in this position, you would be able to see and hear everything that is required. And remember, you only need to be there for the intimate examination and not for the whole consultation. Also, it's important to note, has the patient requested the chaperone or has the healthcare worker requested the chaperone? In some situations, the healthcare worker may request a chaperone, such as previous allegations of inappropriate or abusive behaviour, situations where the patient is known to be aggressive, or if the healthcare worker feels that the patient is vulnerable and would like a chaperone to be present. Also, it's important to consider if there are any safeguarding issues, and in these instances a chaperone may also be required. It's important that you're aware of your whistleblowing policy. We should have an organisation where everything is open and transparent. If any inappropriate behaviour has taken place, then this should be reported quickly and immediately. Remember, we have a zero tolerance policy in place in all NHS organisations. And remember, these are safeguarding issues and they need to be acted upon quickly and appropriately. This concludes the presentation. If you feel that you have got enough information to be able to take the test, then do so. If not, you can watch the presentation as many times as you like before proceeding to take the test. When you have successfully completed the test, you will be issued with your certificate.